on our public notices page. So if you want to go back and catch something, you're always welcome to do that there. But for those I haven't met, I'm Ann Jensen. I'm the Medicaid director here in Nevada. And I'm excited to be here today to talk a little bit more about the impact of some new federal rules on our Nevada Medicaid program and our Nevada Medicaid members. Specifically, we'll be talking about work and community engagement requirements today. This will be the first of a few public workshops related to these federal rule changes, and so I'm really grateful for this team's input and our general collaboration and support as we move to implement these new federal laws. So if you move to the next slide here, we here in Nevada Medicaid are, of course, required to implement all things required by federal law. And that's because Medicaid is a blend of both state and federal partnership. And so as we ask folks to please mute as you join, thank you. As it is a state and federal partnership, we follow both our Nevada state law and federal regulation. And so our federal HR 1 bill, I say that because often the B's trip me up because I know there are a lot of them. So our HR 1 bill, as we'll be referring to it, is a new piece of federal law that was signed on July 4th of 2025. It has a lot of impacts on health programs beyond just Medicaid, but importantly, has a number of changes to our Medicaid program. And so importantly, states do have the opportunity to make choices about how these rules are put into practice as we follow federal law. So today is our first of a few workshops where we will be sharing what those choices are, asking for your input and feedback before our policy decisions are finalized and these changes go into effect. So we'll spend time today explaining the new federal requirements. We'll be sharing a few of the key decisions that Nevada Medicaid will be making. We'll present our recommendations on what those key decisions are and how we've considered those options, and then we'll get your feedback. We'll also talk about the topics of public workshops to come. I imagine there's a lot of interest and questions across a range of topics, and so want to ensure that our work here is really reflective of what you all are looking to hear. So we will move to our next slide. And we'll start with a quick overview of our program. So importantly, we have, thank you for those that are muting, I appreciate it. I want to start with some groundwork on who do these new rules apply to. Importantly, not every Medicaid recipient is impacted by these changes. So if the recipient is a child, a senior, is a person with disabilities, is pregnant, or receives Medicare coverage, this does not apply to you. And so I think that's a really important message, and I think sometimes is lost in some of the national media on this. This is not a wholesale change to the Medicaid program. It's a significant change, but specific to a very particular population. And that population is adults ages 19 to 64 who are enrolled in our Medicaid expansion program. So Nevada expanded Medicaid in 2014. Essentially, that allows people with older children or without children who are making slightly more than the previous income threshold to be eligible to receive health coverage through Medicaid. So that's the population that we're talking about here. Specifically, those that are impacted by these changes are adults without children or with children that are older than age 13. In Nevada, that's expected to be about 147,000 people. If you move to the next slide, I'll share a little bit more data on what that can look like. So I like to think of it as a bit of a funnel. And so at the top of the funnel, once that slide updates, you'll see it's all the folks that are in our Medicaid program. Right now, that's about 760,000 people. A portion of that, about a third of that, is our adult expansion population, 273,000 people. Of those, a number of people are exempt from meeting work requirements, and so the population that is required to is that 147,000 people. We'll talk a little bit more about this in a second, but importantly, we are called to as a state to assess whether someone is compliant with work requirements by using available data to us. So the actual number of people that have to submit additional information is going to be smaller than that 147,000. Exactly what that looks like, we don't know for sure, and that's part of what the policy decisions we're talking about today will discuss. But it's really important to note the majority of adults that receive Medicaid coverage in Nevada are already working full or part-time. So this effort is really primarily to ensure that there's clear documentation on file of that work. And if folks are not working, that they meet other community engagement options or requirements to satisfy this requirement. So I think the bottom line here is, of the overall Medicaid population, about 150,000 people are subject to the work requirements, and a smaller portion than that will have to do something to maintain or secure Medicaid coverage beginning in January of next year. So I hope that's kind of a helpful way to view it. We'll move to the next slide to talk a little bit about what these new rules actually are. Perfect. So there's 3 major changes for the adults in the expansion group. I'll note there are other changes to our Medicaid program that are the result of HR 1, and we'll talk about those in the public workshop. But these are the 3 big ones that impact adults in the expansion group. First is work and community engagement requirements. Second is shifting redetermination timeframes from 12 months to 3 months, or to 6 months, excuse me. And then cost sharing or copays for services is that third component. So we'll go into detail a little bit on each of these 3. Again, today's workshop is really focused on number 1. We'll touch on number 2. Cost sharings and copays, importantly, that doesn't go into effect until October 2028. And we're still waiting for guidance from our federal partners on how states are allowed to implement this. So we'll talk about that one at a future workshop. So at the highest level, work and community engagement requirements essentially require that adults in the expansion population have to complete 80 hours per month of a qualifying activity or combination of activities to either enroll or maintain their Medicaid coverage.
You joined the wrong one, Miha.
We'll talk a little bit more about what those activities are, but they range from working, job training, volunteering, school, or self-employment. So we'll talk about that in a little bit, but that's why we call it work and community engagement, because there are a broader set of activities that would suffice to meet that requirement. Secondly is our 6-month eligibility redetermination. So right now, all recipients on Medicaid renew their coverage every 12 months, once per year. This new law requires that renewal happen every 6 months for some adults in the expansion group. Again, we'll talk about what that looks like, but this is specific to that population. It's essentially doubling the frequency of what that renewal process looks like. The cost sharings and copays will be for some adult Medicaid expansion enrollees that they'll be required to pay at the time of a service for that service. There's some members and a lot of services that are exempt from those copays, and that's what we're waiting federal guidance on, including the amount that those copays will be. So a lot more information to come on that piece that we will bring to a public workshop. I think for the purposes of today's discussion, we can set aside number 3, but want everyone to see kind of the full context of what changes will come for this particular population. If you move to the next slide, we'll talk a little bit more about what counts. If you are undergoing work and community engagement requirements, what is allowed to satisfy that? So as I mentioned, it's 80 hours per month of qualifying activities or earning at least $580 per month. So those qualifying activities include employment, so working at least 80 hours a month, so that could be full or part-time. Job trainings like apprenticeships or trade programs count, also requires 80 hours per month. Community service or qualifying volunteer opportunities at 80 hours per month. At least part-time education. Self-employment, so earning $580 per month from your own work, or seasonal work, so earning an average of $580 per month over a 6-month season. We recognize there's a range of activities that our members are completing on a regular basis, and so our intention is to be as clear as possible on how to document and capture what those activities are to reach those 80 hours. Again, it can be a combination of each of these activities, and so it's really important that we kind of dive into the details of what that looks like. So if you move to the next slide, we'll talk a little bit more about how do we verify that you're meeting those activities. Like I talked about, the federal law requires every state to use every kind of data access point that they have to first verify if someone is already exempt or meeting work requirements. So right now we're undergoing a data review with our vendors to review all our existing data sources and determine if there's new ones that we should be connecting to help identify whether people are meeting requirements. Those are things like employment information from our sister agency at DEER. These are things like education information from our institutions of higher education. The goal is if there's data out there that captures or identifies that exemptions or work activities are happening, we want to use that wherever possible so we don't have to go to our members to ask for documentation. If we do, though, that would be what's called self-identification and exemptions. And so that supporting documentation could be pay stubs, or it could be documentation from a report card or other educational materials. We'll talk about this, but beginning in September 2026, we will reach out to anyone who's impacted by work requirements and include detail on what information we'll need from them. And so it's going to look different for everyone's situation, but that type of self-identification is one allowable option. I'll note we're still waiting on guidance from our federal partners at CMS on what types of documentation are allowable and how we need to be able to audit and verify those materials. So more information to come in a public workshop on that piece as well. But we recognize not everyone will be meeting these requirements or exempt based on our data alone. So it'll be a combination, first of our data, secondly of the materials submitted by our members. For people that are newly enrolling in Medicaid coverage, we appreciate not everyone has health data in Nevada already, right? They may never have been on Nevada Medicaid, or they may be moving from another state. And so what we're doing is building a screening tool that will help members explain their health needs and determine if they're eligible for a medical exemption. And that would be in place of the formal medical records. The verification of that would happen later on, but it's important that we recognize there's not data available for every person that's applying for Medicaid. And so how do we creatively collect that in accordance with our federal requirements? So those three are the three main ways that people will verify compliance. Like I mentioned, we'll talk a lot more about this, but communication is going to be key. So beginning in September of this year, we're going to do a combination of electronic and physical materials to issue notices to anyone who's required to meet these work and community engagement requirements, as well as ongoing reminders of what information that we may need. This communications plan is crucial. I appreciate this is going to be a really important part of our work for the next 8+ months. I'm really grateful. We have a smart team of people here at Nevada Medicaid that will be helping us develop that communication plan, or are already doing that. And we're actually going to have a public workshop later this spring to review this plan and materials and get feedback from our community members. This is an area where we're going to love and really rely on support from our MCOs, our community providers, and other partners that are trusted members of our community that can help us share the message and spread the word about these changes and what may be needed from people to maintain their coverage. So a lot more on the communications piece to come, but I'm hopeful it's helpful to know a little bit more about how folks will demonstrate their compliance. So with that, we're going to move to the next slide. We'll talk a little bit more about who may be exempt. So as I mentioned, there are people that are automatically exempt: kids, seniors, parents of young children, people that are pregnant. American Indians and Alaska Natives are also exempt. And so there's a range of different factors. I like to think of them as grouped in three main categories. Number one is folks can be exempt based on who they are: their age, their status in their family, their race or ethnicity, identifying. These are, again, federally required exemptions in that federal law. The second category is you may be exempt based upon your health needs, and that is reflected in the federal law to indicate that people with complex health needs may not be able to meet these work or community engagement requirements. We'll talk more about what that looks like. You'll hear us use the term medically frail. That's the term in federal law. And so that's what we use to try to be very clear on what that connection is. But really, it's just about, do you have complex health needs that would mean that you are exempt from meeting work or community engagement requirements? The third category of exemption is based on your current situation. So these federal exemptions include if you are incarcerated or recently released from incarceration, if you are a caregiver of a person with a disability, or if you're already meeting TANF or SNAP work requirements. Our colleagues at the Division of Social Services have a SNAP work requirements program that was required to be implemented before the Medicaid one. And so we're working really closely with them to identify the folks that are already meeting the work requirements that are also enrolled in Medicaid. So that way those people do not have to, again, meet Medicaid work requirements for a second time. This is a quick preview of something we're going to talk about a little bit later, but there is a fourth category of exemptions that states have an option to implement. And those are called short-term hardship exemptions. And so currently we're leaning towards offering that, but we'd love your feedback on that decision. And we'll talk about that in a couple of slides. So at a high level, there are three categories that states are required to exempt people from meeting work and community engagement requirements. And those are based on who you are, your health needs, and your situation. So if you move to the next slide, we'll share a little bit more about the timeline here before we dive into the policy decisions. So as I mentioned, this federal law was signed in July of 2025. We have been working on this since it was passed in July 2025. The reason we haven't had a public workshop before then was primarily because we've been waiting for guidance from our federal partners on how to implement it. For those that have read the Social Security Act or even our Nevada law, the NRS, there's a lot of gray areas or maybe parts that could be interpreted different ways. And so every state has to rely not only on the law, but also on guidance that's issued from our federal partners that dictates how states should implement these rules. There has been some preliminary guidance issued by our colleagues at CMS, but the formal guidance, the full and complete guidance on how states must implement these provisions is going to come out in June of 2026. Of course, we have begun our system work. We need to update all of our IT and our technology and begin our patient outreach before that guidance is fully released. So what you'll see here today is based on what we know to be where CMS is focused right now and what we believe to be the guidance that will come forward. We will continue to have public workshops throughout this year. As I mentioned, we'll talk about our communication strategy and materials. We'll have more detail on non-work requirements, HR 1 provisions that will come into effect later. There's a lot of components of this work that we recognize we want to get your input on, and we want to do it in a way that's right for Nevada. So please stay tuned, and we're grateful as always that you lend your time and expertise and support to this work. As always, we'll be posting those on our website and sharing those on our listserv. So as I mentioned, spring, summer, and fall will be continued implementation and preparation. Fall, September is when our member communications will begin, and then overall the new requirements will go into effect for 6-month eligibility and work and community engagement requirements starting on January 1st. As I mentioned, that cost sharing piece begins in October of 2028. So with that, we're going to move into the policy kind of choices and design options section. So as I mentioned, there's 4 decision points that states currently have on how to implement community and work engagement requirements. We're going to go through each of these 4, and for each of them, I'm going to explain the question that we will have to answer. We'll present options that are available to us based on those federal rules. We'll share our recommendation and why, and then we'll ask for your feedback. A lot more info on how to give your feedback to come, but I want to really start with what is the opportunity or universe we have to make some state decisions that are right for our state. So if you move to the next slide, here's a quick summary of what those 4 items are. Short-term hardship exemptions, that's the one I previewed earlier. Second one is, what's the look-back period that's used to determine whether someone is compliant with these requirements? Third is the 6-month redetermination transition. What should that look like in our timing? And then fourth is, how do we define medically frail for the purposes of exemptions from work and community engagement requirements? So as I mentioned, these are the 4 areas where you have flexibility. Your input today and in written comments submitted afterwards will inform our final decisions. So if you move to the next slide, Allie, I appreciate all your help. I'm going to talk about this first one. As I previewed, this question asks, should Nevada allow people to request a temporary exemption when facing a major hardship? And that's defined in federal law as experiencing a natural disaster, hospitalization, having to travel far to receive medical care, or living in a high unemployment county based on federal data that would make it harder to secure employment. So in guidance that was recently issued by CMS, it offered two options for states. The first option is do not offer short-term hardship options and instead stick with the three mandatory categories of exemptions. Option B is to offer this fourth category of hardship exemption. Option A, pros for this would include it's simpler to administer. It's easier if we only have three options from an IT and implementation perspective because there's no additional state processes needed. We recognize, though, folks that may experience these hardships could have trouble achieving the work and community engagement requirements and could lose coverage if they're not able to do so. Option B is that we would add this fourth category. Again, it could help folks protect their coverage during temporary hardships. It aligns with our commitment to member access to health coverage in our state. Importantly, it requires a really robust process for members to request these and to document that they qualify. Our federal partners are looking to make sure that we have very clear and auditable evidence of this, and so that would be part of our process if we choose to go down this path. Right now, we are leaning towards offering option B, particularly given the distant travel for care category. We recognize in our rural and frontier communities, that's a reality for most of our members, and we want to reflect that that may pose significant challenges to them in terms of meeting those work requirements if they have to travel to get their health care. Again, this is an area we do want feedback, though, and so we look forward to receiving that both in today's workshop and in our written feedback afterwards. So that's decision point number one. If you move to the next slide, decision point number two is about our look back period. And this gets a little bit wonky, so bear with me. I'll try to give a couple examples that have helped me really wrap my head around this. But overall, the decision point is when checking if someone meets work requirements, how many months back should Nevada look to evaluate if they're compliant? So there's two situations, there's two times when we'll determine if someone meets work requirements. Firstly, if they're applying as a new or returning member. And secondly, when they're renewing coverage for an existing member. So our federal law provides a couple range of options for what this look back period would be. So that range for the application is between 1 and 3 months before they apply. That means that I'm applying for Medicaid coverage in February 2027. Either I have to demonstrate I met work requirements during January, or I have to demonstrate that I met work requirements in November, December, and January. That's the range of options. Right now, our recommendation is that we do a 1-month look back. So in that situation, it would be the month of January. I would have to demonstrate that I met those work or community engagement requirements in order to be approved for my Medicaid coverage. The reason why we're recommending it is that it minimizes burden on new applicants, and it reflects more recent activity in their kind of life routine or lifestyle, which we believe is a clearer, better indicator on whether and how folks will remain eligible for Medicaid moving forward. So the 1-month look back is what we're currently recommending, but again, look forward to your feedback. There's a slightly different range for folks that are renewing coverage. So I may be an existing member who is up for renewal of my coverage in March 2027. When I go to renew my coverage, I'm going to be asked, have you met work and community engagement requirements? And the federal government allows for either a look back just in the month of February or a single 1 month in that past 6 months, or I have to demonstrate that I was meeting work requirements every single month from September to March of 2027. Right now, we're also leaning towards also having just a single month requirement at any point in that 6-month period before renewal. It reduces the paperwork required for members. It's easier from an administrative perspective from the state because it minimizes what work is required. And it's also easier to document more recent activity and allows for folks to demonstrate what may have happened most recently in their lives. So again, this question is, when you're renewing coverage, during the time that you had coverage, the 6 months that you had coverage, how many of those months are you required to meet that 80 hours per week requirement? So again, we'll continue to seek your feedback on which option we choose. And this, we believe, is the final range that the federal government will allow for us in that final guidance. So this is kind of the world or the range in which we can work. I know this gets complicated, so I hope that's clear. And again, if you have any questions, happy to answer those as we go. But let's move to the next slide here, which is decision point 3. And this question is, setting aside the work requirements piece specifically, moving to that second change, how do we transition to 6-month renewals? So again, as a reminder, the new federal law requires renewal of Medicaid coverage every 6 months, starting in January. Recent guidance from the federal government gives states 2 options on how to do this. And so we can pick between these 2 options. Option A is to reschedule the renewal dates for members that are currently existing. So essentially, Nevada would move your renewal date to create a new 6-month cycle starting in January 2027. Importantly, all members have to receive a notice at least 10 days before any change. Coverage cannot be shorter than 6 months. And this would lead, though, to a large wave of renewals in early 2027. So let's use an example, because that's a little bit more helpful usually to wrap our heads around this. So say you are you receive your Medicaid coverage in June 2026. As of right now, your renewal date would be June 2027. If we go to option A, that renewal date would move to January 2027, so 6 months sooner. If you applied for coverage, say in October 2027, we couldn't make you renew again in January, right? There has to be at least 6 months. And so that would put us in an April 2027 timeframe instead of October 2027. I hope that's helpful. I'm a visual person, so I've had to even look at a calendar to really wrap my head around this. But importantly, this would mean more people renewing, more people being required to meet work requirements sooner in the year during 2027. Option B that the federal government provides is to keep all the renewal dates the same and wait for the regularly scheduled renewal before starting the new 6-month cycle. So in that example, if I enrolled in May 2026, my renewal date would be May 2027. It would not move any sooner. It would still occur in May 2027. At that point, it would move to 6 months, which would mean the next renewal would be November 2027. So again, this helps kind of avoid a larger rush of renewals in January. So it's a little bit more predictable for members and providers and lessens the state administrative burden. So that's why we're recommending that the state go with option B to wait for our scheduled renewal. But we look forward to your feedback on this piece. I'm seeing a question related to, will we have access to the slides? Absolutely. All slides will be posted to our website after this meeting. And we definitely want to ensure you have time to digest and see these materials as you're reviewing to provide feedback. So let's move here to decision point 4, which is the last of our policy decision points. This is a really important one. And this is, how do we define medically frail? So as you will probably remember, as I mentioned earlier, this is one of those 3 mandatory exemption categories and means that the state has to exempt people from meeting work requirements if they fall within this category of medically frail. There are 5 categories that the federal government has defined to be required. Every state has to include these 5 categories. Importantly, they're pretty broad. You'll see these on the left, and I'll read them shortly. And so every state has to be a little bit more specific as we write our policy on what our medically frail definition will be. So our policy, the draft of which is available on our website right now and was sent to the listserv last week when we allowed for an extra week for folks to review this, it includes more specific definitions of what this looks like. As I mentioned before, we will also develop a screening tool for applicants who may not have coverage or medical records that demonstrate they have a clinical condition that meets these requirements. They will also be able to self-declare. If you self-declare using that screening tool, then we will verify with clinical documentation at renewal. I will note this is an area that's really complicated. And so we're waiting more federal guidance on this, which is expected, as I mentioned, in June. We believe this is a path that we can go down, is really allowing us to define this clearly, but I'll note that this may change or shift over time. And so I'll read here the 5 categories that are required to be part of that medically frail definition. These include significant physical, intellectual, or developmental disabilities, disabling mental health disorders, substance use disorders, serious or complex medical conditions, and people that are currently receiving treatment for substance use or other serious health conditions. You can probably appreciate that's pretty big. There's a lot of different kind of conditions that may fall within that. And so I'm really proud of our team's work over the past 4 months to really pull together what we believe to be a very clear kind of level of detail to categorize what that actually means in our policy. So again, that's available on our website. It was sent out last week. We'd love your feedback. It is a draft for a reason because we're hoping for that input to really define and finalize what this looks like. So we'll move forward here. We're going to have some good time for discussion, which I'm glad for. Let's actually move one more slide forward so folks kind of know the timeline we're working on, and then we'll move back to these discussion questions. So as I mentioned, your input today and written comments submitted will inform our final decisions on these 4 areas. We ask that you submit written comments online through our email inbox, eenvha@nvha.nv.gov, or by mail. All that information is available on our website. This comment period will be 30 days. We'll go through the end of April, actually a little above 30 days, to allow really sufficient time for folks to digest these materials and to provide that input. We will review all comments. So please do, if you take the time to share, we thank you for that time and input, and we look forward to reviewing them. The staff and leadership at our division will review this public input. Again, we're looking forward to further public guidance as well, and we plan to make a summary of feedback received available to our website as well. We will then publish final decisions through the website, through stakeholder newsletters and press releases. So changes to member notices and policies will follow after that. Additional public workshops are planned on member notices, outreach strategy, and implementation details as well. So as I mentioned, first of many conversations, and really look forward to having those. Stay up to date through our NVHA website, sign up for that listserv, and we'll continue to keep you posted there. And I just want to flag, I think I may have actually typed in that email address wrong, which I sincerely apologize for. So I'd ask my colleague Tanya to drop in the updated email address in the chat here. We'll make sure that's reflected clearly on the updated and final slides. So before, I recognize some people may have questions, and I'm seeing a couple in the chat already. So Allie, let's go back one slide to our discussion questions here. Overall, here's a couple areas that we'd love to hear from you. Number 1, do the proposed decision points seem reasonable and fair to members? What would help members understand and meet these new requirements? Again, kind of teeing up our communications conversation. Thirdly, how can community partners help support members through these changes? We recognize there's a lot of excellent providers, community-based organizations, and other advocacy groups that are ready and eager to support. And so we'd love to hear from you. How can the state make that process easier? And what do you need in terms of additional information and resources? And then lastly, what would you like to discuss in future public workshops on these changes? Is there information you did not see today that you'd like to hear? We'd love to get your feedback on that. So with that, I'll turn to a couple questions in the chat here, and happy to take others as folks have them. Are there examples from other states about how they're approaching the medically fragile definition? Yes, I think there's a couple examples that are publicly available right now. One is Indiana, that's had these work requirements before and had a medically frail definition that's available. I will say most other states, and I believe perhaps including Indiana, are taking a look at that definition right now, though. So we're all doing this process at the same time. Our federal partners are reviewing what some of those examples are, and I'm also really grateful. These are conversations that our teams are having on a very regular basis. Our eligibility and enrollment team meets with each of our other 56 Medicaid programs to discuss how folks are approaching this, learn best practices, and ask each other questions. I do the same with my peers, the Medicaid directors in other states. So this is definitely a hot topic. I think everyone's kind of finding their way forward, and I expect that we'll have more specific examples, including specific conditions and other things available from other states in the coming months. We're all kind of around the same timeline in this process. So thanks for that question. Any others? I'll be very excited if my calendar explanations with my hands made sense. So please feel free to ask me if that piece doesn't make sense, because I really want to make sure that's very clear. All right, we'll keep moving. I think we have one more slide that has some more information about how to stay in touch on these materials. And again, feel free to drop questions in the chat. I'll go through that slide, and then Julie, seeing your question, I'll get to that in a second. So Allie, if you want to move forward, I believe 2 slides now. I think this will be important information for folks to take forward on the kind of ways to stay involved. Our website, which is new and improved, I hope folks have been able to see. We hope it's a little bit clearer on how to navigate. We also have a regular stakeholder email newsletter that will be available and include information on this throughout the year. And all of our workshops are listed on our NVHA website. The correct email address is listed on this slide, so I'm really glad to see. Again, please submit your comments. We're really excited and eager to hear your feedback, so thank you. Julie, I'll turn to your question here. Are brain injuries going to be included under intellectual disabilities? I do believe that that's included in our definition right now. I will defer to our draft on the website for final confirmation. There's a lot of detail in there, and I don't want to misspeak, but I appreciate that suggestion. That's absolutely something that we will take under review. Someone else is asking, when do you have to submit your decisions to CMS? And will there be an approval for the definition of medically frail by CMS? This is a great question. We don't have super clear guidance on this yet. That's what we're expecting to get in June. We will be doing kind of a demonstration of what our work requirements platform and other materials will look like for CMS beginning this summer. So I do anticipate we will share with them our definition, but there's not a specific date that we have right now that those are due by. It's also unclear whether it's a more formal approval. That's again something that we'll wait for, but we recognize this is a really complex process and we can't wait for that guidance. So we're continuing to move forward on our front, and we'll keep our community partners up to date if anything changes. So thanks for that question. Any other questions, feedback, items that we can provide additional clarification on? Yeah, Maddie.
Hi, thank you so much. This was such a great presentation. I know this is probably going to be going in with the medically frail things, and it's just not determined yet. But when we talk about substance use disorder, is that going to be how long? What is the look back period for that? Is that going to like incorporate people's recovery as they define it? It's really complicated, and I know that'll probably be in later conversation too. But I would love to know about that once you guys find it out.
Yeah, thank you so much for that question. Yes, the look back period is a really complicated piece. I think it's reflected in our draft definition right now, but I believe right now it's set to be a 12-month look back across the board. But I think there's opportunity for us to consider whether a particular condition should have a different type of look back period. And on your point regarding recovery, I appreciate that's a very complicated definition. That's going to be very specific to people. So would love feedback from you and from any others on how best we should think about that. I know there's a lot of national conversation on that piece too. So welcome any resources or ideas that we should refer to there. So thanks for that question. And thanks for joining us.
Appreciate it.
All right, any others? Okay, well, thank you all for joining us. Happy to provide some extra time back in your afternoons. I really appreciate all the feedback here. Again, please submit feedback to that email inbox here. If you want to go back one slide, I think that will help speak to the question in the chat. It will be via email. There's not going to be a more structured survey at this time because we want to give folks an opportunity to share feedback across a range of items or only one, whatever you would appreciate. So we're keeping it more general, but if you have certain things that you would like to us to think through on that front, please do share that again to the nvhaee@nvha.nv.gov inbox. So thank you so much for that. All right. With that, we'll close. I hope you all have a lovely afternoon. Thank you again for joining us. I know this is a significant change that we're all moving through, and I'm really grateful to do it with an excellent community of smart folks that are really committed to this program, and I'm really grateful for your time and energy. So thank you for joining us. Looking forward to doing this work together, and we will see everyone again soon. Take care.